Some of the key deliverables and timeframes that the government's reported in its implementation plan. So as at the end of this year, COAG was supposed to agree those final unresolved primary healthcare areas, but that's probably going to be now in February, we think. And the thing that's really been driving work for New South Wales Health and the Commonwealth has been the commitment to finalise the boundaries for both the Medicare locals and local health networks. They were supposed to be done in consultation between government at the federal and state levels, but New South Wales has actually passed legislation for the boundaries for the local health networks, and Doha has now released its boundaries for the Medicare locals, and I'm not sure how much they actually line up. I haven't done the superimposing of the maps, but it does raise some issues around the ability to provide coordinated care and really doing those the seamless transitions and joint planning and population health-based approaches. That really raises some issues there. So we know as of 1st of January next year, the LHNs will commence in New South Wales, as along with the clinical support clusters. And by mid-next year, the Commonwealth will start becoming the dominant funder of public hospital services, and the transfer of responsibility for the agreed primary healthcare services will also go over to the Commonwealth. And formally, all states and territories have to commence their LHNs as of 1st of July, and the first Medicare locals will also commence. And then there'll be a transition process over to 2012 where the remaining Medicare locals will start operating, and there'll be the move to that activity-based funding for hospitals, and all the other sort of financing reforms and reporting and accountability things will start to kick in from later in 2012. So what's been happening since the original agreement? It's been busy, and I think if you talk to anyone in any of the departments of health, they'll tell you how much work's been going on behind the scenes. June, July, Department of Health and Ageing was conducting some limited stakeholder briefings, and the Director General of Health conducted some listening tours, primarily with clinicians around some of the major hospitals about the reforms. In August, New South Wales Health released a discussion paper on local health networks, and Doha did some consultation on a paper released by the Australian General Practice Network on the boundaries for Medicare locals. In September, they did the recruitment to the LHN governing councils, and they've now announced the 15 chairs for the geographic LHNs and the CEs for the 3 clusters. And then we've also recently had another discussion paper from Doha on the actual governance and functions of Medicare locals. And they've now released, as of a couple of weeks ago, the actual draft boundaries for Medicare locals, and there is a limited opportunity for comment up until next week for any pressing issues on what those boundaries are. So the timeframes for all of these have been very tight. And we would think that some of the consultation that's been happening with the community and some of the health NGO sectors probably not been as collaborative as we would have perhaps liked. I think the focus has definitely been on the clinicians and the hospital focus, and I think it's really important that we're still putting our voice out there and reminding them that we are still part of the health system. Some of the issues that NCOS has with the proposed reform model, and we've had some discussions. We have a health policy advice group of around about 20 organisations that feed in some ideas to us, and some of the things that we've been raising in our submissions throughout this process really is about whether the agreement will achieve its objectives about improving long-term health outcomes. We do think it is quite a medically based focus really around hospitals, around GP clinical services. We really think that reform should be based around that broader social determinants of health approach, which really tries to draw in a broader ranges of sectors than just the health sector. That, you know, responsibility for improving health goes beyond just doctors, and really needs to look at a range of things like transport and education. We don't think there's enough in there to really remedy some of the health inequalities that we know about for people in rural and remote areas for Aboriginal health. There are some good workforce initiatives and incentives for people to be working in some of those areas, but we think there needs to be more attention in some of these areas, particularly oral health is a really big gap as well. the primary healthcare issue is a major one. There's still, even in the discussion paper released by Doha, there was no clear definition of what is primary healthcare. How do you start having a conversation about how you're going to design a system when you don't actually know what your definition is, where your starting point is? We don't know what services are in, what services are out. There's still some issues around the corporate governance for us around the local health networks with these governing councils. Good to get clinician input on these boards, but then, potentials around conflict of interest. Are you going to have community representatives? How is that process going to be worked out? And we don't know what the corporate governance structure will be for Medicare locals. And there are some issues for divisions of general practice because the way that they're currently established and incorporated wouldn't be consistent with it being an independent legal entity. There's a real lack of mechanisms for achieving that, stated coordinated and seamless patient care. How will Medicare locals interact with the local health networks, with health NGOs? How will you achieve policy coordination between the different jurisdictions where the Commonwealth has responsibility for some primary healthcare services but the state retains responsibility for other? How will you achieve that coordination between the acute, subacute, community sectors? So we really haven't seen any proposals for what some of those mechanisms or frameworks might be. And where does our sector fit into all this? We seem to be very much the unspoken or the forgotten about party in the health system. There was little in the original COAG agreement around consumer and community participation, and I think subsequent to some groups making a little bit of noise around that, we did see Department of Health and Ageing give some funding to Consumers Health Forum Australia to do some more consultation around the reforms. But again, we'd also look at the way that the consultation process has been happening, and we know they have some tight deadlines that they have to work to. But at the same time, when you have 2-week turnarounds for major reforms around these new entities, primary healthcare organisations, and there's a lot of documents to download, to read and digest, are we really getting the best system possible? Or, we'd really have some issues around that. So what do we think some of the implications might be for the sector? Well, New South Wales Health has said that they will establish a central NGO unit within New South Wales Health that will sit within, I understand, the Primary Health Community Partnerships branch, and that will replace the contract management that's currently undertaken by the Area Health Services. So that's really to ensure that when the Area Health Services as dissolved as of 1 January, things keep going, you will still keep getting paid. So there'll be the notional transfer of contracts, and Richard Matthews said at a recent NGO review meeting that there'll be no substantive changes for health NGOs during the transition process, apart from those associated with the normal performance monitoring processes. So it doesn't mean that you can actually stop performing because they won't be paying attention, but it does mean don't panic. Things will keep going, and they are trying to do their best to maintain some stability for the sector. They've also advised that the third quarter grants payments are going to be brought forward to early December to avoid that transition period over January. However, it is still unclear where a lot of services in our sector fit. So, I think youth health is probably a really good one. We know there's some discussions happening with mental health and drug and alcohol about what will happen with them. Maternal health is another big gap. So really, we're still unsure exactly how these services will be positioned, whether they'll sit within a cluster, whether they'll sit within all of the clusters, whether they'll just sit within Department of Health. So still some issues to be worked through. But what will happen if Big Bad Barry gets in March? Well, he's recently come out and said that he wouldn't sign up to the health reform deal in its current form. He wouldn't surrender the GST to the federal government. The Liberal Nationals have had a policy out for quite a while around the introduction of health districts, which actually preceded the COAG agreement. And they've said that they still would go ahead with introducing these local boards. Whether the local health networks would be the same sort of geographic scope and would able to be subsumed by the local boards, I'm not quite sure. He did say that he reserves the right essentially to change the system following community consultation. So there's a little bit of a question mark as to what would actually happen. I would tend to think that expediency would say you'd build on what's already gone through with the LHNs, and they didn't oppose the legislation when it went through Parliament a month or so ago. So again, that's another factor to bear in mind when we come to March, that we still may see some changes in New South Wales. I'm conscious of time. NCOS has been keeping a watchful eye on the reforms. We've tried to get some information out for the sector. We have some briefing papers on our website. We've been trying to organise a joint governmental briefing which got put on hold after the federal election, and then we thought we'd do it after COAG in December, but now that's not happening till February, so we're hoping to maybe do something in February. And we've been involved in making submissions to the Medicare Locals, LHN's discussion papers. Our policy advice group is also putting together a position paper where we're going to try and build some alliances with the sector and also some other organisations like the Public Health Association and other organisations that might be able to build up some legitimacy for our position and help us sort of fly the banner for both the NGO sector but also that broader social determinants of health approach and really pushing that through. And we're also working with the other state and territory causes to develop up some joint responses as well. So how can you get involved? Definitely recommend you sign up to get the updates from the Your Health website, which is the Commonwealth Government's site that has all the information about the reforms. That tells you essentially the guts of what's happening in terms of the implementation. It also has some background to the agreement, and they'll send you email updates when anything comes through. So, for example, the Commonwealth's recent announcement around telehealth, which will be trying to improve online consultations and video conferencing through the after-hours services, that they send all that sort of information through. So worth having a squiz at that. You can always write to your state and federal health ministers. New South Wales Health has a reforms email address you can write to. And definitely think about what you can do collectively as a sector and through your peak body, because obviously united you have a bit more of a voice and a bit more leverage, and I understand you're having this consultation in February, so that's a really great opportunity to do some work now, have a think about what some of those issues are potentially for your sector, where you want to position yourselves, and really push for that, I think, when you meet in February. So thank you. If you want any more information, you can always jump on the NCOS website. I do have some of our newsletters, and if anyone's interested, Vote One Fairness in New South Wales election platform, which I'll leave on the table outside if Jason doesn't mind, next to the applications for membership, I'm sure. So that's